Hi everyone, welcome back to the vlog. Today we're talking about the 7 most common mistakes that I see pet owners make when their pet is not eating right, a little bit picky, a little bit inappetent. Let's jump in, let's break it down. I do have other videos on things you can do when your pet can't eat, but the reason we're talking about it is new product alert. I am so excited that we finally have Elura. I've been waiting for this for quite a long time. This is the kitty cat version of Entice. What are these? These are appetite stimulants for dogs and cats. Entice has been one of my favorite drugs, and it's not just for cancer patients. So please listen to this. Please watch this video. There are so many other situations where your dog, your cat may need an appetite stimulant. And that's why I'm doing this video, because I see so many common mistakes that pet owners make. So we're gonna dive into that. But first, let me real quickly tell you what Elura and Entice are. So they are capromelin. So basically they are a ghrelin agonist. What the heck is a ghrelin agonist? So ghrelin is your hunger hormone. So, around lunchtime, around dinner time, when your stomach is getting all rumbly and growling, that is your hunger hormone. It is ghrelin telling you that it's time to eat. And so when you're inappetent, when there's other stuff going on, whether it's cancer or you're on pain medications, or you have chronic kidney disease, pancreatitis, GI disease, antibiotics, there are so many medications that cause a poor appetite. You need an appetite stimulant, and that's what these medications can do. So they are one of the medications that can help our dogs, help our cats get on track to start eating again. So let's dive in. Let's talk about the 7 mistakes that I see owners make when it comes to their pets not eating. Okay, number 1, they tell me their pet is picky. And I say, did you give the Entice? And now I'm going to be saying, did you give the Elura? There's also Mirataz for cats. Sometimes we're going to be using Serenia, which is a nausea medication, because nausea is one of the reasons that dogs and cats may not be eating. And sometimes, I'll circle back to this, we're going to be using more than one medication. But owners will say, no, my pet's just picky. And they think that these medications are only for complete anorexia when their pet is completely not eating. No, a picky appetite or decreased appetite or changes in appetite is a sign that your pet is in need of an appetite stimulant. And I know, because I do this for a living, people tell me, they'll try other foods and things like that. And they want their pets to eat on their own because appetite is quality of life, right? When I put down my dog's food, right? And they eat and they lick the bowl, and then sometimes they lick there's such a joy when our pets eat their food. And so we want them to eat on their own, and we don't want to have to go to medication. But sometimes in many situations, as we'll go through, they need those medications. So picky, decreased appetite, not finishing their food is a sign that they may need an appetite stimulant. So please talk to your vet. So the first mistake I see is that 1, they say that they're picky. Number 2, my pet will eat people food, but they won't eat their food, and they think that that's fine. And I'm not saying that it's not okay for a couple of days, maybe after surgery, that they have a picky appetite and that they're going to eat their food and then go back to it. But all too often, pets that are on chemotherapy, that they have chronic conditions, so chronic kidney disease, heart disease, chronic GI disease, owners will say, that they'll eat my food, but they won't eat their food. That is a sign that they might need an appetite stimulant. Not eating their regular food, but they'll eat other food is a sign that, again, maybe it's time to get an appetite stimulant, other ways to stimulate their appetite. Third mistake that I see with pet owners when their pets won't eat is they don't know how to get the medications into their pet. And that is because a lot of the times, if their pet won't eat, maybe you were giving them Serenia wrapped in food, and now they won't take their pill pockets, they won't take the food wrapped in cream cheese, so you don't know how to get it. One of the nice things about these medications is they are liquid, but still you may not know how to get it. One of the tricks is to take the syringe, put it in the corner of the mouth, and shoot it in. I'll be honest, I've been told by pet owners, these don't taste great, but still get it in. It's worth it to get it in. If you're having trouble, a lot of the times your veterinarian and technician can show you at the practice how to get it. I don't want you to get bit. So if you have a sassy pet, especially a cat, and you're uncomfortable, maybe, someone at the clinic can help you get in. But, if you don't know how to get those medications in, that's going to be hard because you've been used to using food and now they won't eat. So you need an alternative plan to get those medications in. So I do like the fact that both of these come in liquid so you can shoot them into the corners of the mouth, make sure they get them in. I do have another video on how to pill dogs for those situations like Serenia when you're trying to get them in. So I'll put a link below to that. And another thing is, in general, it's not a great idea to be putting medications into your pet food, especially cats super sensitive to smell. Some medications can cause food aversion and can taste really bitter, and they're going to associate that medication with the food. So again, if you're having problems getting the meds in, talk to your veterinarian, maybe a technician, one of the nurses at the hospital can show you how to get those medications in. Fourth mistake I see is I gave a dose of Entice, or now I gave a dose of Elura, gave one dose, gave 2 doses, didn't work. Medication doesn't work. Sometimes these medications can take more than 1 dose, and I've seen a couple of different responses. I've had some dogs, I've been using Entice longer now for a couple of years, where the owner will give a dose and the dog goes over 30 minutes later and starts eating, and they are, yay, miracle drug, they're so happy. But there are some times where it can take up to 5 to 6 days of the medication before we see a response. And so just because you gave 1 dose and it didn't work doesn't mean it doesn't work. So I usually tell owners to give it for a good 5 to 7 days. And sometimes the drive for your pet not to eat can be really strong. There can be multifactorial. It could be multiple things going on. Remember I said it could be cancer. Pain can cause a pet not to want to eat. Pain medications can cause them not to want to eat, and maybe they're on antibiotics. So there could be so many things driving that pet not to want to eat that it's not just going to be 1 dose. They may need more than 1 medication. That's tip number 5, is they may need more than 1 medication. So it may not just be Entice or Elura. They may have something that's causing nausea, so they may need that Serenia. Sometimes we may use Mirataz, mirtazapine, or other medications as well. So talk to your veterinarian, see if they need to add other medications as well. I can't make recommendations because I don't know the specifics about what's going on with your pet. But I can tell you, in many of my patients, I will use multiple medications for inappetence, nausea, and things like that. And sometimes I have to find the right combination. In some pets, I will use Serenia with mirtazapine. In some patients, it's all they need is Entice. On some patients, it's going to be Entice with Serenia. So it's going to be a little bit different in each patient. Talk to your veterinarian, talk to your specialist. The 6th mistake that I see pet owners have with inappetence is just not understanding that it really is multifactorial. It's not just a simple thing that causes a poor appetite. And I've already told you about, the many different things that can cause a poor appetite, inappetence in dogs and cats. And sometimes it's going to be acute, something, that happens really quickly. And a lot of times it's chronic conditions, but it can be the disease itself. So cancer, heart disease, kidney disease, GI disease, so pancreatitis. So it can be lots of different diseases that are going on. So many medications that we use in our pets have a side effect of causing poor appetite. So non-steroidal anti-inflammatories can cause it. Antibiotics can cause it. So a lot of the medications, heart medications, other medications that they may be on can be contributing to their inappetence. They may need to be on antibiotics. That can cause it. Pain itself. So did your pet just have surgery? That can cause it. Stress can cause it. Maybe you just moved to a new place. There are so many different things that can contribute to that, poor appetite. My 7th mistake that I see people make is not starting these medications early enough. And, our pets lose weight, they lose muscle mass, And there are studies that show that animals that have a decreased body condition score of lost weight can do worse. It's really important to identify that they may need these medications sooner rather than later. And then the other thing that's super important is when you go in, inappetence is actually one of the most common reasons that dog and cat owners go to the veterinarian. Your vet may still be working up the case, meaning running tests, trying to figure out what the cause is. You should be going home with these medications. It frustrates me when I have a pet come to see me and they haven't been eating and they're not yet on these medications yet. Because we just found out what the diagnosis was 2 days ago when the biopsy came back. It doesn't matter. While you're still working up the case, getting the appetite, is so important. We need to make sure we're getting nutrients. So ask for Entice, ask for Elura. Say, what can I get to help my pet start eating while you're running the test and figuring out what's causing them not to eat. So make sure you ask for these. Be your pet's advocate. That's it, guys. Those are my 7 tips. I hope they were helpful. Thank you so much for watching. Look forward to seeing you at the next vlog.